How to become a psychiatrist. What is the educational path to becoming a psychiatry specialist? Number 1. Undergraduate education. The first step necessary to become a psychiatrist is to complete all of the undergraduate prerequisites for admission into med school. This usually includes completing biology, chemistry, and physics courses. Most students obtain a Bachelor of Science degree, but having a bachelor's degree is not a requirement for some medical schools. The Medical College Admission Test, MCAT, must also be completed prior to applying to medical school. Additional steps that may or may not be required to become a medical student include conducting research, shadowing physicians, volunteering, holding leadership positions, and working in medical environments. Step 2. Medical school education. Once admitted, medical school education is 4 years long. The first 2 education years are spent in the classroom, attending classes, and taking exams on campus. After the first 2 years, a med student will take their first board exam, the USMLE Step 1 for an MD student, or COMLEX Level 1 for a DO student. During the last 2 years of school, students go to teaching hospitals to practice medicine in clinical rotations. During that time, med students take their second board exam, USMLE Step 2 or COMLEX Level 2. During the last year of school, medical students rotate and work at hospitals throughout the United States and interview with different residency programs. To be a psychiatrist and pursue psychiatry training, med students would do audition rotations at hospital they would like to match into. Students match into residency programs during the last few months of medical school. Step 3. Residency. After graduating from medical school, students officially become a physician and can practice medicine, but only with proper supervision. Even though they have finished medical school and have become a physician, they cannot practice alone until residency and specialty boards are completed. Psychiatry residency lasts 4 years and allows recently graduated physicians to gain more hands-on training, practice, and education in a specific facet of medicine. During the first 2 years of residency, the final USMLE or COMLEX Level 3 examination is completed. Towards the end of the residency, psychiatry residents will take their psychiatry board examination. Once residency is complete and board examinations are passed, they can obtain board certification and are able to fully practice medicine on their own. Step 4. Fellowship. Some residents may decide to pursue more extensive training in one of the 9 subspecialties of psychiatry by applying for a fellowship. Fellowships are not required for licensing, but instead are highly competitive programs that are limited in the number of attendees and reserved for top candidates.